Hi, I'm Morse, the founder of Core Elements Training. In this short video, we're going to demonstrate clinical dry cupping to the shoulder region, primarily focusing on the anterior, lateral and posterior deltoid, along with the biceps and triceps. So in a wider clinical dry cupping session, you can treat the deltoid when you're treating the pectoral region or when you're focusing on treatment of the upper limb from either the prone or supine position. However, this sideline position is really nice if we're trying to get some wider movement into the shoulder joint, because from this position we can do circling motions or circumduction at the shoulder, and we can also do a soft tissue release variation technique as well on the biceps and triceps at the same time. So it's quite nice from treating your client from the sideline position when you get the opportunity to. So we need to apply our massage medium first of all before we pop the cups on. So for the purposes of today, I'm using lotion and I'm using the Physique lotion, but you could use any medium that you normally already use within your clinic, whether that's oil or whether that's wax. Okay, so I'm going to apply the medium first of all to the area, and we're going to use a little bit more medium than you would do normally. Okay, so for manual massage, you might not use very much medium at all, especially if you're doing more myofascial release techniques when you're trying to get more grip on the tissue. But because we're going to be moving the limb with the cups on, we want to make sure that we're not creating too much friction. So I've placed the medium on. Doesn't have to be fully absorbed. And then from here, first cup I'm going to place on is going to come over the head of the humerus. So if we palpate right at the top of the humerus, we can quite often find lots of little trigger points. So it does feel quite nice and releasing to pop a cup over the top of that region. So I've put 2 pumps in here today. Katie's used to having cupping treatment, so I've placed 2 cups on there, but I'm making sure that I'm asking the client for their comfort level. If it causes pain or it feels too uncomfortable, then we need to take some of that suction out. And I'm using the Dongbang cups today, which has a little bit of a release valve on the top here. So if I wanted to release some of that pressure, I can just tweak the top and some of that pressure will come out. And I can also add additional lift or additional suction into the cup as well whilst it's on. Then I'm going to come down. So quite often we've got common trigger points in the middle of that lateral deltoid. So on palpation and examination, if you find that a client's got a lot of tension here, it's quite nice to place a cup directly into the middle of that muscular area. But also there's another common trigger point near that deltoid tuberosity, slightly further down. And that can be quite active in a lot of people, especially if they've got a lot of tension into that upper trapezius area. So palpate for around that area near that deltoid tuberosity. And if your client is holding tension there, then we can place another cup here. Sometimes we'll feel a line of tension as well coming down towards the elbow, and you could continue to place cups around that area. I'm now going to come nearer the front of the shoulder, nearer to that anterior deltoid. Okay. So we're going to hit all of those deltoid heads. Okay, so I've just placed another one onto the posterior deltoid as well. Okay, now before we start moving and making sure, I'm double checking all of the cups, making sure they're nice and secure, because as soon as we start moving, sometimes the cups will start dropping off. Okay, so if it's your client's first treatment, static cupping might be enough, and it's absolutely fine to leave the cups on and do no movement techniques whatsoever. However, if they're comfortable and you really want to reduce that muscular tension and increase that range of motion, those movement techniques are really useful, especially if you're limited on time. So we can do this actively or passively, but I'm going to ask Katie to do it today. So she's going to keep her elbow slightly soft, and she's just going to go into a circular motion. We're going to start off with a small motion, so coming anterior and posterior with a little bit of abduction there. So she's doing that circumduction. Starting off in one direction with a small movement and gradually getting slightly larger and larger depending on how it feels for her. So when the clients are doing these techniques actively, it's quite nice because they're in control of the movement and they can increase that movement depending on their feeling or stay with a smaller movement if it's feeling quite intense. Once they've done anywhere from about 3 to 6 repetitions in one direction, then we can change that direction. So Katie started off anti-clockwise and now she's moving in that clockwise direction. Excellent. How's that feeling?
That's good.
Excellent. And what we're hoping to see is that range of motion gradually increasing. You'll also probably see once the client starts moving, you'll see the colour coming into those cups quite quickly. The benefits of the movement is that, excellent, and relax, thank you. Benefits of the movement is that the client is creating that muscular contraction. So the cups are increasing that localized blood flow through that suction. But when the client is moving, they're also increasing that internalized blood flow because they're producing muscular contractions, and they're also producing heat as a waste product, both of which will help that muscle tissue to relax as well. So those movements together, the vacuum cupping and the client's moving, are going to be synergistic of one another. Okay, so we can now make a decision. We can leave these cups on statically as the pressure that they're at, or we can increase more suction in those cups if the client's no longer feeling much of an effect. So we're going to leave those cups on as they are, and I'm now going to place a cup into the triceps on the back of the arm. So her arm or her elbow is in an extended position. So because it's in extension, the triceps on the back of the arm are going to be in a shortened and relaxed position. They're relaxed because her arm is resting on the side of her body there. So I'm popping 2 cups on here. And then what I'm going to do is get Katie to flex the elbow. So I'm relaxing, and she's just going to relax her hand down. So her biceps are now in a shortened and relaxed position. Okay, so depending on the injury and depending on what you're wanting to achieve will depend on where you place those cups and whether you put multiple cups on or not. Okay, so I've just put 1 cup into the bicep there today, and I've got 2 slightly smaller cups into the triceps. Okay, and now we can either actively or passively extend the elbow. So I'm going to do it passively at first. So I'm taking the weight of Katie's arm, and I'm just going to gradually extend that elbow and flex. So I'm just gradually extending. It might not go all the way at first, and I'm checking what's happening to the cups here and what's happening to the cups on the back of the arm as well, on that triceps area. So I've just shown her the movement that I want her to produce. I've done that 3 times, and now I can give the weight of the arm to Katie. So she's going to continue with that movement actively. Okay, so now she's having to purposefully contract and relax the biceps and triceps in order to keep producing that movement. Excellent. So what we're doing here is, because we placed the cups on when the muscle was in a shortened and relaxed position, we're now doing our cupping variation of soft tissue release. So this is helping again to reduce that muscular tension and increase mobility at the elbow joint if our client has had any restriction or discomfort around the elbow region. Also, if we've got problems around the shoulder area, biceps, tendon, etc., then we do want to come into the shoulder with our cupping techniques, but also into the biceps as well. Excellent, and then relax. Okay, so generally 3 to 6 repetitions will produce that relaxation response when we're doing that soft tissue release technique. So I'm just taking these cups off. Again, this might be enough statically or doing the soft tissue release techniques with your clients in one treatment. If they're comfortable with the cupping techniques, then we could finish off with some slide cupping as well. Never tend to go straight in with sliding because it's quite a heavy technique and it can sometimes be quite uncomfortable. So we've already released some of that muscular tension with our static cupping and our soft tissue release techniques. So now I've just placed 1 pump into the cup and I'm sliding around the area. So when we do our sliding technique, we always test the cup first. So we put the pressure in, finger and thumb, Does that cup move relatively easily? If it does, brilliant. If it feels too light and it hasn't got much traction, then we'll need to put more suction in. And if we need to yank the cup to get it to move, it's too tight. So we want it to move relatively easily, but creating some traction between the client's skin and the cup itself. So now that I'm sliding around that area, we can see that erythema coming up quite nice and quickly. And the nice thing with a vacuum is because it provides a lift, we can slide longitudinally, transversely, and all around this upper limb area. Front to back, around the deltoid, and then straight over the lateral head too. Okay, so that's a demonstration of clinical dry cupping to the shoulder area, or focusing on deltoid and biceps and triceps. So this is just some of the techniques that we cover in our accredited day CPD course in dry cupping therapy. If you'd like to find out more, then please visit the website. It's just www.coreelements.uk.com. Thank you.